of people that are addicted to drug or use drugs, according to the World Drug Report 2020, UNODC, United Nations Office on Drug and Crime. But one thing it's important to note that apart from these traditional kind of drugs, and which we can see that cannabis has reached incredible powerful concentration of THC, we have also a wide number of new psychoactive substances created in home laboratories that contains many different kinds of psychoactive substances not yet identified actually and not yet scheduled by the control system. So they are sold in the deep web and they coexist at the global level in most countries with the most traditional kind of drugs. The worrying thing is that in most countries that used to be only production or transit country, now there is a consumption of many different kinds of drugs. And the other very worrying thing is that most of the people that use drugs do not choose just one kind of drugs, but they use any kind of substance they can put their hands on. Legal and illegal substances. We are aware of the non-medical use of prescription medication, which is widespread in the United States, but not only, also in Western Africa and in many other countries. So polydrug use is the norm, which makes the problem even more complex if it were simple before, but it was not. So a complex challenge, a complex problem requires complex approach in order to identify long-term solution as required by the Angles outcome document. Also, the San Patrignano Observatory confirmed this data. In 2018, the people we welcome, around 400, only 29 of them used syringes for their drug abuse. And there was a 5% that was affected only by cannabis use disorder. And the norm, 85%, the vast majority, were polydrug users. In front of this complex challenge, there are two main approaches. One is the medication-assisted treatment, which has some goal, limitation, and strength, as well as the recovery-oriented intervention, which also has goals, limitation, and strength. Let's see which they are. Medication-assisted treatment has the goal of reducing the complication of drug use, and mainly overdoses, that we know has very high percentages, especially in the United States, but also in Europe and in other countries. This approach is based on the idea that drug addiction can be totally solved, but can be controlled somehow, can be the damage, the harm can be reduced, and of course eliminate the overdoses death. But the risk of this approach is that chronicization of drug use disorder is quite at hand, easy to reach, with the normal consequence that the continuous use of substances, illegal or legal, has on people's health. The other limit is that it is applicable only in patients with opioid use disorder, while for other kind of abuse, there is not any kind of agonist or antagonist medication. The other issue that we have seen in our 40 years long experience is that people in medication-assisted treatment often do not reduce the use of other substances. And this is even more true now with polydrug use so spread among this population of drug consumer. The recovery-oriented intervention has as its main goal not only abstinence. Many people think that this is the main goal, but I would say that abstinence is a collateral effect. The real goal is to increase the quality of life of people, to help them to recover their autonomy, their self-sufficiency in society, and to recover their active role when they go back to society. So, of course, at the basis of this reasoning is that drug addiction can be solved, can be totally overcome, and so it is not chronic, even though it is, we recognize that it is a relapsing problem. It can be applied, this is a positive aspect, in any kind of dependence. So polydrug abuse or behavioral addiction, which are quite common today, nowadays, included. But the limits, the important limits, is that these programs are considered very costly and too long to be sustainable. But what we know, what the science tells us about addiction, this is important to know because recent research, they give us a wider and clearer scenario about the drug use disorder. So all the drugs target the reward system and damage the reward system. We know this is quite shared by all the scientific community. This damage to the reward system make people unable to experience gratification through the normal activities of the daily life, let's say good food, sex, a walk in a beautiful place. They can experience gratification only when using drugs. This is a chemical condition that, of course, make the problem very difficult to overcome. But there is a good news, this damage can be repaired. The brain can change in worse, but even recovery its original functioning, and the neuroplasticity of the brain tells us that the damage can be repaired, but it is necessary that the recovery process is long and complex enough. This is the problem. There is not an easy and quick solution, quick fix of this problem. We have to think about long-term solution. Before going to the details, some details of the program that we have at San Patrignano, I would like to say that it is not based on a theoretical model or some structured set of rules. I would say that it's based on a vision. People, Vincenzo and all those who started this process in this program in 1978, has a very special vision about the people that asked them for help. They saw them as unique, special individuals, human beings full of potential that they only need to be helped to rediscover and to express again, to gain their self-esteem and to be able to trust and to have self-confidence. I also would like to share with you this acronym, HERMES, which in my opinion clearly synthesize and summarize which are the fundamental elements of the recovery process, not only according to San Patrignano, but also according to other communities with which we made this European project 3 years ago. We discussed it and find that these were the elements that all of us shared and had in common in order to approach the problem of addiction with a good quality of the approach. HERMES means that it must be human-centered. It must be empowerment aimed. It must be reintegration oriented, motivational driven, educational embedded, self-sustainability focused. And the last one, social need oriented. I explained this last one, the other are self-explained. But social need oriented means that we discover that this approach can be applied not only to people with problem of drug use disorder, but also with other social needs, such as immigrant, homelessness, prisoners, or people that are in conflict with law, all those who are social marginalized can gain some advantages from this kind of approach. To center the program on people's needs means to focus on their specific need that some special group of people might have, which means that you have to consider the gender-based issues that are related to women, which is not only that they might have kids, but they have special pattern of abuse and special needs that they require in order to recovery and to be offered a recovery path. San Patrignano also hosts adolescents, people in conflict with law, and we changed 4,000 years of jail into rehabilitation program. We have people with health issue. All of these people has to be welcomed in a recovery program. Otherwise, you would marginalize them one more time. So people with health issue are also quite common in people with drug use disorder. So 3,000 people with HIV infection and 15,000 people with HCV. And I'm glad to let you know that we totally eradicated HCV from our community in this year, 2020, in this terrible year, let's say, but we succeeded it. And also we organize some local voluntary organizations that help all over Italy that can help and support the families of our residents during the recovery program. Also, mental issues are important. Now, people speak about trauma-informed approach. I would say that we have always used this concept because we have always thought that there are root causes to addiction. And the main one is sexual or physical abuse in childhood, which is one of the most important reasons for people to start later in their life a process, a path toward addiction. And also they might develop eating behavior disorder, identity disorder, and other kind of mental issues that need to be addressed in parallel to the therapeutic path to get out of drug use disorder. But the main problem that is quite common to all our people is unemployment. 85, this is the situation of the group of people that were resident in San Patrignano in 2017. I made a quick survey and I discovered that 85% of them at that time were without any kind of employment at the time of their admission in the community, which means that work and giving back to people the possibility to work and to be integrated into society also in this level is fundamental. Work is dignity, work is identity, work is self-esteem for people that can contribute to society. So to empower people to be able to work means not only give them the technical capacity of a profession, but also accompany them through the social process that enable them to have good relation with other people. Empowerment to me is a key word. I discovered it a few years ago, and I discovered that it applied perfectly to what people should receive when they are in a recovery process. Because empowerment, we can see in the middle of my slide, involve mutual respect, critical reflection, caring, and group participation, through which people lacking of an equal share of valued resources gain greater access to and control over these resources, which means that the people that do not have access to their own personal resources, but also to external resources, when empowered, are able to use their own talents for their future and to access also to external resources that enable them to change their life, to really change their lives. There are three pillars that are fundamental. We should never forget to help people to have motivation to enter in the program and to enhance their motivation all through the program. We have to give them hope, because without hope, people don't want to access a program, don't want to commit to a long and tiring and stressing and really demanding period of recovery. And also the carer, the staff, should focus on the strengths of people, not on their weakness, because they know very well their weakness, but they need to know that they also have strengths. So at San Patrignano, the recovery is based essentially in two phases. The first one, we try to rebuild their life skills through interpersonal relationships. This capacity of learning again to relate to other people gives them individual and social accountability, which is fundamental to start, after a period of time, a quality vocational training course that could be in any field according to the area in which they discover they could be interested in being trained. So we have 40 different kind of training opportunities. They can access to any of them. But also the training should include meaningful activity during their spare time. People that have been at the margin of society for years need to go back to society feeling useful, feeling that their capacity is valuable. They want to give back to society. In a research that my friend Professor David Best made, 70% of people in recovery do some voluntary activity, compared to less than 40% of the normal, let's say, population. So this means that people in recovery has a great deal of intention, of desire to give back. This is a nice photo of our study center where people can resume the study interrupted because of addiction. There are 100 students every year, more or less, 1,800 since 1989. And also the vocational training opportunities. In 2018, we organized 16 different courses for 354 people. These courses, of course, have a cost, but we organized them in collaboration with the Emilia-Romagna region. We asked for funds to the European Social Fund, to the National Fund for Youth, but also in collaboration with private foundations and companies that believe in the social value of San Patrignano and wants to sustain it. For example, L'Oreal helped us for this hairstylist course, or we organized last year a cheese factory production certified course, and also a fashion stylist course with an important firm of Italian fashion. The result of this commitment, let's say important work, is that at the end of the process, 85% of our people has a job in the moment they leave the community. 15% are still unemployed because they have some familiar needs and they will look for a job later after they leave the community. As you can see, the activities are many different kind, and most of them were learned within the community. So we can see that empower and recovery a person means to give to society the opportunity of regain quality members of it. So most empowered individuals are basic pieces for the group, the organization, and for society. So we should never lose the opportunity to help these people, to put them in condition to give to society their contribution. Of course, this is a costly commitment. And so how does San Patrignano sustain And also, is it possible to measure the social return of investment of this investment? Let's start with how San Patrignano sustained itself. We gain around 69% of our revenues from our activities, and 32% come from donations. Around in 2017, around 5,350,000 euros. In order to measure the social return of investment, we considered only 3 proxies. There would be many that should be considered, but we decided to limit our studies to 3 of them. One is the values generated by the reintegration into society of people with a job, with a salary, taxpayers, and this value is considered more than 3 million. The other is the reduction of drug addiction cost, because people in recovery cost to the state, but San Patrignano is free of charge, so the state save around 23 million euros. And the third one is the reduction of crime cost, because an average cost per day per person in prison is 150 euros, but at San Patrignano they are welcome without any cost. So we save to the state 600,000 euros, more or less. We have to sum up the 3 numbers and obtain this 29 million euros that, reported with the input, with the donation received, give this 5.21, which means that for each euros that people donate us, we generate a value of 5.21 euros. This is a study that was made by the Lewis Business School, University, and Católica Lisbon School in Lisbon. So we can see very easily that recovery is a cost-effective approach to addiction, because not only gives back to people, to the single individual, the possibility of regaining their life, of having their life back on track, but also give to the family and to their communities a new member, a new contributing member. So thank you for your attention, and I look forward for your question and to answer it. Also by email if you want. Thank you. So let me stop sharing. No, how? Maybe I can.
There you go.
Okay.
Okay, well, thank you so much, Monica, for telling us about your work and recovery at San Patrignano. That was really very interesting. I love hearing about your program. So we're going to get right into our second presenter. Dr. Roberto Connais currently serves as the co-director for the Argentina chapter of the International Society of Substance Use Professionals. Previously, he was the Undersecretary of the Secretariat of Comprehensive Policies on Drugs of the Argentine nation, the Director of Addictions Observatory of the Buenos Aires City Government, and a researcher of the Psychiatric Epidemiology Program of CONICET. He is a member of the scientific committee of the journal, and I'm going to mess this up, Acta Psiquiatrica. It's a psychological and psychiatric journal in Latin America. He's also a U.S. Department of State International Visitor Leadership Program Fellow, a full professor at the University of the Argentine Social Museum and the University of Salvador, and a postgraduate professor and Master of Psychopathology and Mental Health in Asociación Psicoanalítica de Buenos Aires. He completed his Doctor of Psychology, graduating summa cum laude from the University of Salvador, his master's degree in community mental health from University degli Studi di Cagliari in Italy, and community treatment specialist from the University of Paraíba in Brazil, and his postgraduate in governance and political management in San San Andreas University and George Washington University, and a Bachelor of Psychology degree from the University of Salvador. So thank you and welcome, Roberto. Roberto, can you unmute?
Hi.
There you are.
Hi. Okay. 1 second for share my screen.
There we go.
Okay. Good morning. It is an honor to be on this panel with Monica. Before we start, I want to apologize for my basic English. I'm sorry. I would like to especially thank Amy and the Free American Foundation team, and the president of the Obra Social Ferroviaria, Dr. Juan Cifré, for allowing me to represent the Obra Social and give me the opportunity for directing the Research Institute. And thank you, the General Secretaries of the Railway Unions, Sergio Sacia and Omar Maturano, for their usual support. Okay. The Obra Social Ferroviaria has been providing medical coverage to the staff of railway companies since 1944, being a pioneer in Argentina as an organization dedicated to workers' health. Currently, it provides coverage to 80,000 workers throughout the country. Has been developing health prevention programs for several years, especially in cardiovascular health, among other pathologies. And since 2008, it has a program of prevention of addiction based on the formation of health agents. The program is carried out in articulation with the unions of Unión Ferroviaria and the Fraternity, and the collaboration of the company. As we know, prevention programs need the articulated work of all actors to be as comprehensive and inclusive as possible. This is how the program was designed. Since 2008, yes, 8,000 workers have been trained in 16 provinces. In total, Argentina has been 24 provinces. Prior to launching the prevention program, a research conducted with active participation of workers. It aimed at describing social and cultural aspects of alcohol and drug use. It is important to note that that part of the culture of the railway workers is based on the concept of the railway family, which function as an informal support network among co-workers. The concept of the railway family is a cultural aspect which proposes the same as members of a family. It is a support network, but it also gives a sense of identity. This is a very important point. Other highlights of this first study are the naturalization of alcohol consumption, especially in some workplaces, the highest consumption in most risky or stressful workplaces, and we take development of a prevention program, particularly the sense that consumption has within each workplace. Their material was for the prevention program, together with the workers, with a focus on prevention and break stigmas of consumption problems. This is a very important point because prior to the development of the problem of consumption has seen as kind of plague which must be hidden. Then, through an agreement with Humsa University, a diploma was organized through which 49 workers receive university certification. Throughout these years, different materials produced to support the program. Manual for the prevention or abusive consumption of alcohol and another addictive substance, gambling prevention manuals, guides for the training workshops for health workers in addiction prevention, material is for coach of coaches, an awareness campaign was carried out with problems treated, not punished, with a presence at stations and workplaces, with a great participation of young workers. And in the recent years, we make some publications of research in indexed magazines. This is a central point because we care a lot about living evidence in all the process. Okay, all the development of the action as adjusted and committed to the guidelines of the UNGAS 2016 and the Sustainable Development Goals of the United Nations. With these documents as a reference, access to the program are active participation of the workers in the whole process, evidence-based program, gender perspective, human rights, and public health approach. To strengthen support networks, create awareness of the program, and actually in the year 2020, the context of COVID-19 pandemic is incorporated, contemplating the impact of the isolation on consumption and adding up virtual formats in all the activities. We also did research that, among other topics, showed the impact of the pandemic on mental health and substance use. In this way, we were able to identify an increase in mental health indicators and not so much an increase in alcohol and drugs use, probably due to prevention action in recent years. So this is a point to investigate. During 2019, a survey was conducted to evaluate the prevention program. I will share some indicators from that study. This study is about to be published in an indexed journal. Among the workers who went through prevention program between the years 2016 and 2019. In standouts, the almost nearly 19% value quite a lot and value very much the basic knowledge received in the training. 19% also value very high the knowledge received about the concept of abuse and dependency. For us, it was very important to differentiate this concept. First, to raise awareness of the complexity of the problem, and then also to destigmatize people with consumption problems. Nearly 85% consider that the training received in the program is used to face the problem of drugs use at work. I think it is because the contents of the programs have many operational aspects. In 2018, the prevention program received quality certification granted by the National Agency of Drugs Policies, CEDRONAR. The certification is based on the fulfillment of a series of quality indicators agreed by the cooperation program between CELAC and European Union in drugs policies, COPOLAT. This is the document which defines the quality indicators. The basic indicators are: is there a writing document that describes all the relevant elements of the problem? The program includes general, specific, and operational objectives. And the program includes strategies designed to facilitate the accessibility of the potential beneficiaries. And the program includes a plan to evaluate its implementation, coverage, and results in which they are identified, etc. The comprehensive treatment program for substance consumption has a network of devices of different levels of complexity, coordinated by the Obra Social mental health team. This is based on the network of rail worker health agents, who are the first point of support, in many cases refer to a consumer problem. And also key, here is this concept I mentioned before, the railway family. Between 2008 and 2020, 342 workers were assisted in the care program. 97 men and 3% of women. The average age is 36 years old. Regarding the devices used, most of the users were treated in ambulatory devices and the hospital. Regarding diagnosis, according to DSM-4, they were following. Alcohol is the most relevant substance, and in most of the cases are polydrug. We recently conducted a study with more than 75 evaluation indicators of the treatment network. I will take 3, which can account how patients evaluate the care received. Specifically, satisfaction with the care provided by professionals, 100% say they agree or strongly agree that is satisfactory. 92% are agree or strongly agree that concrete solutions to their problems were proposed. And 100% affirmed to recommend the care received in the program. Finally, during this time of the 42 workers who entered treatment, 92.6% returned to their jobs. This was possible not only because of the treatment received, but because this whole process of labor reintegration was supported by support networks among workers, awareness worked for the prevention program, the commitment of the Obra Social, the unions, and the companies. Because we always worked from the evidence, with diagnosis and evaluations, and by putting workers at the center of every action taken. But the most important point is the political endorsement of the leadership of the Obra Social that is of the value of evidence and the value of prevention in health policies. Thank you for your attention.
Well, thank you so much, Roberto. It was very interesting. Okay, we are going to go right into our questions and answers. And so I understand we have Dr. Juan Cifre, who's the president of Obra Social Ferroviaria, to join us for questions. So let's get started. And remember, if you have a question, please put that into the chat box now so that we can ask that of the panelists. Let's see. So our questions, let's get started. This one's going to be to Monica. I'm sorry, we have a little feedback here. What is the success rate of the community, and are there follow-up studies about the outcomes?
Yeah, of course, in order to understand if our approach was working and effective, really, we asked independent institutions such as universities to study our approach and to make follow-up studies in order to understand if people living the community were in good condition, what the outcomes were positive. So one study made in 2005 and another one made in 1995, and both gave as a result a success rate of 72%. 72% of those that completed the program were drug-free and social reintegrated in a drug-free condition.
Okay. And Roberto, how long do the treatments usually last in your program? You're on mute. You're okay. You should talk. Oh, you can't hear? Okay. Dr. Cifre?
No, I can hear you, Karen.
I can hear you now.
Yes, yes. How long do the treatment generally last? Is the
Yes. Yes.
Okay. It depends on the several levels of the diagnosis. In general, as we saw in the presentation, the predominant treatments are ambulatory, and the works carried out by health agents often allows early interventions. Therefore, the treatments are becoming shorter and less complex for this job. The health agents is very important in this structure, in this network.
Okay. I have another question for you, Roberto. Is the program that you have available for the workers, is it only for the workers, or do their family members also get any benefit from this?
Oh, it's for all the workers and the families. All the manuals is the focus is all the family. It's very important this point.
Mm-hmm. Because we know that that when a family member has a problem with substances, that also affects the worker in their daily work, because they're worrying about that family member and trying to do whatever they can do to help. So let's go over to Dr. Seafray. Are you with us? There he is. Can you hear? We need to unmute you. Here, let me do that. Okay, there you go. So I wanted you to describe the communication and coordination between the railway companies, your Obra Social Ferroviaria, and the unions. Can you hear us, Dr. Seafray? Okay, I guess he can't hear. Okay, we have another question. This question is for Roberto. Have other sectors followed your lead in Argentina in terms of workplace treatment and support?
Now, other sectors is in the beginning. A program like the Obra Social Ferroviaria is the first of this kind. But another sectors is taken this model. I think in the future, the model of programs based in evidence with workers' participation is taken for other sections, for other unions too.
Mm-hmm. Okay. Okay, Monica, let's go over to you. Tell us how the COVID-19 pandemic has impacted San Patrignano in your work, and how. I know that's been a big problem, in this field because of the isolation. But what's going on with that at San Patrignano?
Well, COVID has had a strong impact on mental issue all over the world. Of course, the issue regarding the community has been mainly technical. I mean, the fact of being all together here helped our people not to feel the sense of isolation that people isolated at home as experiences. So this part was quite easy, let's say. But the problem, of course, were many. For example, we couldn't welcome new comers for some months in this spring when in Italy the problem was at an incredible level. So we had to totally close the community to any newcomers, to the visit of the relatives, to the resident. They only were able to have telephone call or video chat or something like that to get in contact with the relatives. And now the problem is again increasing in Italy, so we are thinking about addressing and starting again this kind of issue, unfortunately. The other problem was that employment is difficult in this COVID period. Many people lose their job and has difficulty in finding a new job. And so it was very difficult for our people going out from the community at the end of the completion of their program to find a job. So the social integration was made very difficult by the COVID situation, by the economic situation caused by. I would like to take this chance to congratulate Roberto for this project that the Obra Social Ferroviaria made, because it's really a huge project reaching out a lot of family, a lot of people in a large territory such as Argentina, and very good one. It's something that should be replicated by many organizations also elsewhere. My congratulations.
Oh, thank you, Monica. It's important, your feedback. And congratulations too for your job. It's very important, the model and all the years with compromise with people, no? With congratulations.
So Roberto, I'm going to pass over the same question I gave to Monica about the COVID-19 and how that's affected your program and what you've seen over the last, the past year, 6 months, what have you. Can you hear Roberto?
I don't hear you.
Okay. So COVID, I was trying to find out how COVID has affected your program. Okay. Well,
I can
okay.
hear you.
Okay.
Sorry.
We're trying to find out how COVID is affecting your program and what you've seen over the last 6 months to year. I think we're still having problems.
Yes, sorry, I can hear you.
Okay. I'm going to go back over to Monica. Okay. Okay.
Which is the question?
Yeah. Can you elaborate a bit more about the length of the program and how it's organized? I was just wondering how long your participants spend there at San Patrignano on average.
Well, as I said in my presentation, the program is a long-term program. So they remain at San Patrignano between 3 and 4 years, which is quite a long period of time. The last part of the program is dedicated to the social integration. They go back home for a period of time, then they decide which kind of solution they would like to implement for the future, which kind of job, where they want to live, with their family of origin or not. And so the last period of their stay in community is the period of their choice regarding their future. We have also, I've seen in the chat questions about the relapse rate and the relapse prevention. Actually, I mentioned the more than 40 associations that are spread all over the Italian territory. Our people that ends the program at San Patrignano then can stay in contact with these associations that are directly in their city or close to them, so that they are able to have some support in when they have some difficulties, when they have to face or to tackle with some difficult moment, they can have this support. So the relapse prevention is based on the work done by the associations, the organization, voluntary associations that work in the field. They do three different jobs. They prepare people to enter the community before the admission. They work in the family during the period of the stay of their loved one in the community. So also the families do their own path accompanying the recovery of their loved one. They also need to understand better which were the mistake, what they can do better, which is the situation, so that the situation can a little bit be changed before our residents go back to their family. And the third part of their work of this organization, voluntary organization work, is to help the social reintegration.
So I see that Dr. Cifre has added that the rate of relapse in their program in Argentina is very low because of the closeness of the railway worker with his containment network allows him to act, or allows them to act quickly. So they have less than a 4% rate of relapse. So I thought that was pretty interesting. So, and I want to, Roberto, I don't know if you can hear us now. Can you hear?
Okay, I hear you.
Okay, I want to just go back for the last question here about the impact of COVID on the program and what you've seen observed for the last, 6 months to a year or so.
Oh, it is a great question. I think it's very important the growing up for the process, and for me this is the more important, and the consequence is every time is the time of recovery, the work for every people is more or less. It's important continue the process of the evidence and the program. I think is very important for the future.
Okay. Well, it is after 9 o'clock here, and so we're going to close it. I want to thank Roberto and Monica for your presentations. I think that this is a really important topic, and maybe we can address it again in the future. Just a quick reminder that we have our next webinar series for her workplace. That'll be in December. We'll send out the invitation later today, or we'll send out that invitation. Please watch for the survey that'll come later today. And we'll also send you the information about the International Society of Substance Use Professionals. And then you can also join the workplace-based work group. And then let's see, I think that's it. So the recording and the slide deck will be available when we send you the survey and stuff like that. So So this concludes the webinar. Thank you very much for participating, and we hope to see you at the next one. So thank you so much.